So, hey everyone, I'm Sam Alkin and welcome to our COVID-19 office hours. I don't know about everyone else, but about 2 weeks ago, I'd say it was beginning to feel like we were turning a corner on this pandemic. And now here we are. Florida just had its highest day of positive cases ever. Mask mandates are being reinstated in many places. And I know members on this panel have reiterated time and time again that COVID-19 is going to be with us for a long time. And the fact that this is our 50th office hour with one of our highest pre-registrations highlights that COVID-19 is going to be a challenge we'll be dealing with for the foreseeable future. Now, we did just hit finally the 70% vaccination rate for the country, and some locations have higher rates, but there's a lot of discussion going on what mitigation practices do we need to keep in place, which ones can we bench, and how do we manage this ongoing risk, and as we've seen, respond to rapid changes in it. And that's the crux of today's special office hours. Now, I'm going to introduce the panel and then have Al give an update on the webpage before handing it over to Martin to lead that discussion. And then we'll get into the Q&A. There were a lot of questions submitted, and I'm sure more are going to come up during the hour. So getting to the panel, we've got Dr. Olga Padilla-Zakor, who's a professor of food science and the director of the Food Venture Center here at Cornell University. We've got Tommy Saunders, who is the Southeast Regional Extension Associate from the Produce Safety Alliance. We've got Dr. Martin Wiedmann, the Gellert Family Professor in Food Safety. He's the co-director of the New York State Integrated Food Safety Center of Excellence. We've got Dr. Aliosa Trimick, who's an Extension Associate in our Dairy Extension Program, and our COVID-19 resource guru. We've got Dr. Callie Neal, a professor of microbial food safety in the Department of Animal and Food Sciences at the University of Delaware. We've got Melanie Neumann, who is the Executive Vice President and General Counsel of Matrix Sciences International, joining us today and will be part of this discussion. And I'm Sam Alkin, an Assistant Professor in the Department of Food Science. So that's our lineup. We've also got officials from New York State Ag and Markets from both the Food Safety and Dairy Divisions on the line, in case there are any regulatory questions as things are changing. If you want to ask a question, just type it into the chat box. You'll see there's a little button there at the bottom of your screen. It'll pop up the box. You can type in your question, either send it to me directly or to everyone, depending on how you want to do it. It's okay. Or if you're on the phone, you can use *6 to unmute yourself. So with that, Al, can you give us a quick update on the webpage?
Sure. Let me just share my screen. So the first update is, of course, our coronavirus booster from July 19th, where Dr. Alkin gives us an update on the state that COVID-19 in US is. He gives us some information about the vaccinations and the New York State HERO Act, which aims to help protect workers from airborne diseases. One link that we added was from CDC, which is guidance for implementing COVID-19 preventative strategies in context of varying community transmission levels and vaccination coverage. So with the Delta variant coming in, with the fall coming in, and the vaccination not being quite there to say we have herd immunity, these are the guidance to help us navigate this times. If under templates and trainings, I have to emphasize again that we have training for fresh produce farms and packing houses, which is a really good resource for training your employees. With the training, I have to also mention that we have a full 11-module course for food industry managers and supervisors. This is a great resource, especially now with New York State and the HERO Act, which says that, you know, we're not just going to get through this pandemic, but we're also going to get ready for the next one. And talking about getting ready, maybe if I go back to templates and trainings, make sure you visit again our links to our checklists, different decision trees, verification spreadsheets, SOPs, all in all very useful to put in your toolbox. Very important with this times is to make sure you're up to date on what's going on in your local area, so you can use the links to our COVID-19 trackers to follow the numbers. Under the same tab, you can find peer-reviewed papers where we have a number of different papers that show the minimal risk of vaccines as well as maximum benefit that vaccines can offer us. With this, I would finish. If there's any questions or or if you have any comments, make sure you use our contact list on the page to let us know how we can help you, and see our virtual office hour tab for our next virtual office hours. And with this, I'm going to finish and give it back to you, Sam. Thank you very much.
Great, thanks, Al. A lot of great resources on that website, and those training videos are great. I highly recommend that if you haven't looked at them yet, to kind of incorporate them into your training policies. So with that, I'm going to now pass it over to Martin to start off, this discussion on what we can do with our COVID-19 interventions and where we're going.
Great, thanks, Sam. Can everyone see my slides?
Yep, it looks great.
Cool. Obviously, the title sounds a little bit, counterintuitive and maybe not even appropriate for what we're seeing right now with the Delta variant. But I think we need to have the discussion of which interventions can we roll back, when, where, and how, and which ones are here to stay for the short and the long term. Take-home messages from this presentation, which is going to be a joint one with myself and Melanie, is that despite the Delta variant spread, there are some interventions that we feel strongly can be rolled back. And these are the ones that are well documented to not be needed. And the major one here is frequent sanitation of these frequently touched surfaces. Other interventions are essential. And to me, in that category falls vaccination. A large number of interventions will have to be implemented risk-based. And those are the ones we mainly going to talk about. And those are the ones that are starting to frustrate people. We hear words like, why is CDC flip-flopping? They're not flip-flopping. They're adjusting to changes in what's happening. It's just like, if your speed limit on a road is 65, but you have black eyes, you're not driving 65. The risk changes by times, and we need to adjust. That is what we're seeing right now. It's something we've always emphasized, that these control strategies need to be risk-based. As we implement them, we need to balance legal requirements, employer rights with the employee culture in order to get maximum benefits. And Melanie will talk about that part. So what's the current situation? Obviously, numbers are going up. As you can see on the right side, Sam talked about it. Over 80% of the new COVID cases in the US appear to be caused by the Delta variant, maybe plus minus a little bit. We see hotspots again. This is a New York Times map, and you see clear hotspots. So if you have food processing facilities in some of these hotspots, obviously, this is a major concern. If you're in the areas that don't look like hotspots, obviously your concern is will it become a hotspot. What's the story with the Delta variant that contributed to these hotspots, to this increasing number? It appears to be clearly more transmissible than the original version of COVID-19 virus. We remember early on, we had a lot of conversations about R0, which is the rate if one person is infected, how many other people can or will that person likely infect, assuming there are no interventions in place. And that R0 for the original coronavirus was somewhere around 2. With the Delta variant, that seems to be in the range of 6. So this one is considerably more transmissible, or maybe more contagious, if you want to use a different word. And that is one of the major concerns. That's why we going back to some of these preventive measures, such as wearing face masks, as a need, particularly in high-risk areas. With the Delta variant coming out, we see emerging evidence that even fully vaccinated people can transmit the virus. And this is where we need to be really careful. A lot of people, or some people might interpret the vaccine isn't working. That's not what we say. The vaccine still very effectively protects against illness, protects against death due to COVID-19, but we have seen that vaccinated people can shed high levels of the Delta variant and therefore can transmit, sometimes with symptoms, sometimes without symptoms. And that is what some of these new or re-emerging recommendations trying to address, the fact that even vaccinated people are at risk in spreading this variant. So where does that leave us with strategies for the food industry? And this is the chart that we've put together, that we've pushed for a while. And clearly getting the COVID-19 vaccine, making sure your workforce is vaccinated, still has to be in my mind, number one in terms of your intervention strategy. That's essential. That's not risk-based. That is what we need to do. And we've had an office hour about that 4 weeks ago, which I will refer you back to. The rest of the strategies here will be risk-based. And we got to go into those some more. How do we assess risk? And then the ones that I would consider distractions at this point, because we know from the science that frequently touched surfaces are unlikely to transmit the virus. So those days where we where we cleaned and disinfected frequently touched surface every hour are gone. That is not something that is needed at this point. So let's talk a little bit about vaccination. If you have a 100% vaccinated workforce in a facility that's located in a community that's high vaccine coverage, that will put you in a situation where it can allow rollback many of the interventions, including on the social distancing side. So that does obviously throw up the question, is it time for the food industry, for food companies to require vaccinations? Melanie will talk about, that legally, that is absolutely a possibility. We also discussed that at the last office hour, if you want to rewatch this. But in order to get there, we might have to start with some new ideas and new thinking. There are concerns that employees might move if you ask them or require them to be vaccinated. So maybe we need to form local alliances to really make sure in a whole region, companies all agree that we're all going to require our employees to be vaccinated. Food for thought, but I think it is time and there's a need for new approaches where we are right now. For the rest of the interventions, we talked about it, we need to focus on a risk-based approach. And just as a reminder, SARS-CoV-2 is the hazard, or in this case, right now, we might say the Delta variant is the hazard, but just because it's there doesn't mean it represents a risk. The risk is a continuum. It can go from low to medium, high, etc. And we need to assess what that risk is. And based on that assessment, change our interventions and change what we do and change what we require in our food processing facilities. So what are some of the key drivers of the risk as we try to assess the risk? And this is straight from CDC, not a specific recommendation for the food industry, but general recommendations. And they have 5 components of assessing the risk. How much community spread do we have? Where are we with regard to the capacity of the healthcare system to treat people that are sick? What is our vaccination coverage? Can we quickly detect when the numbers increase? And what proportion of the population is at risk? If you have high vaccination, low community spread, and low levels of other risk factors, that means there's less need for masking and other prevention strategies, including the threaded social distancing that may affect our productivity in food processing facilities. So how do we assess the level of community transmission? CDC provides some very good specific guidance, 2 metrics: new COVID-19 cases per 100,000 persons in the last 7 days, percentage of positive DNA-based or nucleic acid-based tests in the last 7 days. It even tells you what should be considered low, moderate, substantial, and high risk. Gives you the numbers here. You go by the highest category. If a county is in the high risk based on new cases, but in the moderate based on percent positives, it's still a high risk county. There are tools available. As Al pointed out, CDC now has a COVID data tracker where you can drill down to the county very quickly. You can get very detailed information on a county, percent of total population vaccinated, cases per 100,000, deaths, percent positivity, it's all there. So you can very quickly, very easily assess that risk. As a side note, as I throw this up, what's important when we talk about percent fully vaccinated, we often hear numbers that seem to be very different, and often that is because the denominator differs. Is it percent of total population, or percent of people, percent of adults, or percent of people that could receive the vaccine, which I think is at this point 12 and over? So depending on what denominator you use, that percentage obviously will change. So make sure you pick and look at the right percentage value. Health system capacity. There could be a metrics for food processing facilities too, even though it's probably more for the public health system. Is if you're in a region where there's not much public health coverage, hospital beds are full and covered and full, and there's no capacity, that puts you in a situation where you have to consider yourself being in a high-risk county and in a high-risk situation. COVID vaccine coverage. You can see there's a wide range of coverage by counties, as Sam mentioned, more than 50% coverage, only in 417 counties throughout. And CDC very clearly, and you're going to see us push this today, and it says, emphasizes how important it is for organizations to establish supportive policies to allow workers to receive vaccines. That includes paid leave to get vaccinated. Also, and very important, flexible, non-punitive sick leave options. Many employers are concerned that if they get vaccinated and then they have the side effects and they have to stay home for 2 or 3 days, they might not have sick leave days. It might negatively affect their employees' status. They might not get a bonus, etc. So we need to be very, very careful to make sure that we don't have any incentives in the system that will prevent people from getting vaccinated. Capacity for early detection of increases in cases, that obviously applies sort of at the county and state level, but that can also apply to companies. Do you do serial testing of unvaccinated workers? Do you have the capacity to quickly identify if the number of cases in your workforce increase? A lot of questions around that, including the cost of this, who bears the cost, but something for industry to consider. So as you implement these risk-based COVID control strategies, that is not always simple, because you have to be nimble, you have to be flexible, because the risks will change as we see, and sometimes very quickly. So we're back to recommendations we made early on in the pandemic. Each company should have an expert, a COVID czar, who is responsible, who assesses the risk, who knows what's going on, who will make the calls, or at least a recommendation in terms of what interventions to require again. The key non-pharmaceutical interventions, masks and social distancing. But it's not enough to require them, and this is old news for some of you, but we need to make sure that we verify that the interventions are implemented, that the masks are worn correctly, etc. We're back to all those things that we talked about early on in the pandemic. It might be time to do refresher training. It's been a while for training. And another thing in this risk-based control strategy is companies need to also consider the value of what I call consistent implementation. Let's say, yes, face masks are required versus, oh, for this week they aren't, next week they are, then they are not again, because the level of transmission in our county changes. Probably not what I would do if it were my company, and I've talked to some food processors. They've never gone away from requiring masks for all their employees, despite the fact that they had decent vaccination coverage, just because it became too challenging to differentiate between vaccinated and non-vaccinated, et cetera, et cetera. So, but if you're in a situation where you're not requiring it, make sure you have the right infrastructure to determine whether you should require mask wearing now, or whether you should, or when you should implement it and what your triggers are. With that, I'm going to turn it over to Melanie, who's going to talk about the legal and practical considerations of both the rollbacks and requiring vaccinations, et cetera.
Great, thanks, Martin. Thanks for that overview. I really appreciate it. I don't have a whole lot to add here, but I will give some color commentary. How about that? In part because we did have that deeper dive discussion on the legal ramification considerations that you had posted a link to in a prior slide as well. Just making sure I can advance here, but I think we're in an era now with COVID controls where a lot of companies are asking themselves about this delicate tightrope, right? Imagine the scales of justice or a teeter-totter when you were a kid, and trying to balance business risk with regulatory risk, with brand reputation risk, and the risk around people safety that we're responsible for in our workforce, and really kind of, you know, struggling with what's the best thing to do on a go-forward basis as the risks of this pandemic change. I will start by saying, you know, there are some employment law factors to consider under that legal umbrella. First and foremost being that the Equal Employment Opportunity Commission does state that employers do have the right to require or mandate, if you want to use that word, vaccines for those employees who physically enter the workforce or the workplace. That's subject to a couple of exemptions. I'll cover quickly on the next slide that are mentioned also here, because there's a couple of nuances there that sometimes get a little glossed over that I think is worth warranting a little bit more comment. But there's some other of these acts that are still in play, from the CARES Act that provides the pandemic unemployment compensation, to the FFRCA, which is the Families First Response Coronavirus Act that allows for paid sick leave, family sick leave for coronavirus related issues such as can't achieve childcare, illness of the staff member or the employee, etc. So it's really, I think we're in an era now where it's very easy to come into what I'll call COVID fatigue and lose sight of these various different expectations on employers, and also then balancing that against the need to do business, or to really get product out the door, and to be as operationally efficient as it can be. All the while, there has been some lawsuits. There's always a fear and a threat of lawsuits. If I'm going to be, you know, damned if I do and damned if I don't, if I mandate or if I don't mandate. There's been some examples that I'll cover here real quickly. And then I think we're seeing more contractual types of provisions that the pandemic has shown that become very important. Things like what's called a force majeure clause. That's usually the natural disaster acts of, you know, unforeseen acts, strikes, labor shortages, and now pandemics and epidemics that are literally being written into contracts to say, I don't have to perform when I can't perform due to an epidemic or a pandemic. And those are some things that help with things like supply chain disruptions. It helps with, you know, honoring customer contracts in times like these, but certainly wouldn't want to see them used as, you know, as a way to kind of offset your requirements to perform. Let's put it that way. Trying to advance the slide here. Sorry about that. There we go. It's a slow roll today. But under the EEOC laws, the Americans with Disabilities Act, the Rehabilitation Act, Title VII, etc., employers can mandate, subject to sincerely held religious beliefs or a disability under the Americans with Disability Act. But note the and in both of these exceptions. I think we have to keep in mind, at least from an employer perspective, yes, we absolutely have to provide reasonable accommodations to those with sincerely held religious beliefs or disabilities. But for example, in the sincerely held religious belief, we also have the opportunity to show that if this imposes an undue hardship on the employer, if I can't run my business with a quorum of a workforce that is vaccinated, that I can ensure the safety of the staff, for example, and that rises up to the level of an undue hardship because I can't operate without that level of staff, then perhaps that reasonable accommodation isn't required. These aren't real bright line tests. These are very gray zones, but I think it's worth warranting that these reasonable accommodations that are required by law, and we must do our due diligence and be committed to providing those to the employees who qualify, We also have the right as employers to say, you know, if this really hamstrings my business and causes an undue hardship for my ongoing operations, I don't have to provide that reasonable accommodation. And so those are some things to consider. And I think, you know, this really comes to the conversation that some companies are, you know, sometimes get a little paralyzed or not really sure which way to pivot when it comes to legal risk, but ultimately understanding we also have to balance the business risk, the brand risk, and other types of regulatory risk. And we may run afoul of a regulatory requirement if we're not staffed appropriately. There may be, you know, an issue in servicing our customers or being able to meet the demand and the orders of our customers that we also need to take into consideration here. There has been some good precedent that's been set. For example, Houston Medical led the way in mandating vaccines for its staff. Some employees did file a lawsuit as a result of that. And the hospital's position has been upheld by the district court that was hearing that case. While the employees plan to appeal that finding, personally, and all the attorneys in the space that I speak with think that this is going to be pretty difficult to overturn. And because there's been a long-standing precedent dating back to 1905 in the case of Jacobson versus Massachusetts, it was a smallpox outbreak. There was requirements for smallpox vaccines. Mr. Jacobson didn't want to take it. He was going to be subject to a $5 fine if he did not get vaccinated. Sued the state, and that went all the way up to the U.S. Supreme Court, and it was upheld that in times where there's a direct public health threat, that vaccines can be required. That same holding and that same precedent was upheld in 1922 when it came to requirements around certain vaccines of school children to attend public schools. So we've got a really long-standing platform of precedent that says, in times like these, vaccines can be mandated. So who now is requiring vaccines? Just a recent list in Forbes listed all of these companies on your screen here, from Disney to some airlines and folks in between, who are requiring vaccines for those who are coming on site. Some have explicitly stated that employees can work remotely, but have also acknowledged that over time there may be some unintended and adverse consequences associated with that, because many of these companies will limit travel opportunities for those who are not vaccinated. For example, trade shows and conferences may be truly deemed a privilege now for those who are vaccinated in order to help ensure the safety of the employee and the safety of others around them. Some of these companies are requiring the vaccine for non-union workers and are currently undergoing negotiations with labor unions to try to get their bargaining agreements adjusted so that they can require for union workers as well. So the union issue becomes a little bit unclear at this point, but there is definitely some precedent in progress that you could monitor and watch. A lot of these companies too have revisited or extended their return to office dates as a result of the Delta variant rise and peak that we're talking about right now as well. So just know that there are some other companies who are, you know, leading the way in mandates that we can follow, we can learn from. Certainly they do have that right, and I'm sure they're all doing their own internal risk-based analysis on what is best, both by way of legal exposure to them, but also the ability to fulfill their obligations to their employees, to their customers, to the public, to their shareholders, to grow, to not just remain in business, but to grow. And it is tough. It's definitely a risk-based balancing act that requires a lot of various different factors. And I guess I would ask, you know, some companies who say, well, the legal risk is too high for me to mandate. What if an employee gets really, really sick or worse? Yeah, that is a consideration when you're thinking about mandates. my question is well, what if you don't? You know, what happens if 20 of your employees become ill because you're not requiring vaccines and you're not able, for whatever reason, to maintain masking or social distancing? There's the kind of the catch-22 or the other side of the coin to also analyze, to say, if I don't take action based upon new information and new risk criteria, like the difference in the R-naught Martin had explained, like the risk assessment the CDC lays out to say, if you're in a county with this transmission rate, you're in a substantial or a high risk area, and you don't then revisit and readjust your COVID control programs accordingly, at least up and stay there, right? You know, there's an opportunity that someone may allege that that's maybe negligence, right? So there's a lot of varying degrees of criteria that should be weighed here, ultimately all based on risk and not being too paralyzed on the legal risk at the cost of other risks. Said from a lawyer, right? I think the other thing to keep in mind too is as we work through incentives, CDC is encouraging these supportive policies as Martin recommended. Incentives need to be what they call de minimis. Not so big and so overwhelming that it looks like it's almost coercion to get a vaccine. And also employers need to provide a way for those who truly do qualify for the reasonable accommodation due to either a sincerely held religious belief or a disability under the ADA, to also be able to find a way to provide them the incentive as well. Otherwise, that could actually be viewed as a potential employment discrimination based upon religion or disability. An example of this, Kroger provides a $100 gift card. I believe it's $100 to its associates for getting a vaccine. But if they qualify for the reasonable accommodation, they can also get that same $100 payment if they complete a health and safety education course. So that's the example of making sure that incentives are fair. They're de minimis, they're not so exorbitant, so much money, so big that it looks like we're coercing our employee population to get a vaccine, and also provide that vehicle for those with reasonable accommodation qualifications to obtain the same type of incentive. And I think all of this really needs to be taken in the context of pandemic planning is business continuity planning, plain and simple, right? We don't build a business continuity plan or a crisis management plan and then put it on a shelf for 10 years. It's dynamic, it's meant to be evergreen, it's meant to be revisited based on risk and based on the material changes to your business, the market, and the community risks. So I would encourage everybody to, put a plan in place at a certain cadence to revisit these policies, regardless of CDC tells us to, regardless of if the risks change in certain areas, or if they go down and they stay down, and also use and rely on a risk assessment, of some sort of an objective risk assessment to say, this is what I'm basing my decisions on. And if you maintain that consistency in approach, that becomes a very good platform and a very good story to tell, to say, these are how I made my decisions. I've made them consistently throughout this pandemic and any future pandemic that there might be. And that becomes a really good way to, for lack of a better phrase, defend your positions and the decisions that you're making. So moving forward, we just have to balance worker safety, the safety of our employees, and the decisions we make, whether to mandate, whether to incent, continuing to supply the PPE and do the appropriate risk-based sanitation. To Martin's earlier point, maybe we can reduce some of that frequently touched surface sanitation, but through the lens of making sure that we've got an operationally efficient program we can actually implement and we're verifying is being done and is actually working, so that ultimately we can ensure that going forward we're keeping our finger on the pulse of supply chain disruptions, supply chain integrity, and the ability to operate our business in a way that isn't too unduly burdened by the legal worry than it is making sure that we're putting people first. We're putting people health and safety first, and that we're really fighting back against this COVID fatigue that we all have through education and communication on an ongoing basis. So with that, I think I'm turning it back over to Martin.
Okay. Thank you, Melanie. And we're back to the take-home messages. I'm not going to reread them. I'll put them out in the beginning, but hopefully we added some meat to these bullets. And I'm going to turn it back to Sam and open it up for questions.
Great, thanks. That was a great discussion. We're going to have that video will be available of the first half of this office hours will be available on the Institute for Food Safety's website. So look for it there.